Welcome back. It's Dr. Matt again. I wanted to discuss Profit Activator number 8. Monday I discussed Profit Activator number 7, which was getting the case out of SIU if you're participating in the management of the treatment of your patient. And there can be some things that we can do that can make a big difference. And I wanted to share some significant points. And as I discussed at the end of Monday's Profit Activator, I did discuss the clinical aspects and bringing it back to what we do as clinicians, right? We can make some recommendations to our patient, but what do we need to do in terms of case management? The physician is the most important part of the Colossus-related software, whether it's Colossus or Teach or Decision Point or Claims Outcome Advisor, Injury IQ, whatever the system that they're using, doesn't matter. Every insurance company is using one. Because of the vast majority of the information that determines the value is taken from the provider's notes. So what do we need to be aware of clinically that can make some big differences? Obviously, concussions, huge factor, right? Well, look, 70%, as we discussed in one of the earlier Profit Activators, 70% of all concussions are coming from motor vehicle accidents. Make sure you take that history and detail what the patient has described and that the potential headrest or B-pillar or side window or airbag that induced that. I was recently testifying on a case and that was one of the issues. The patient didn't state that their head hit any objects, the doctor didn't know how to properly handle it, and therefore it was considered that the patient was malingering and the symptoms were not real. Make sure you're documenting those symptoms from start to finish, the initial, the SOAP notes, the progress exams, the final exam that the patient had, whatever symptoms might have included, dizziness, blurred vision, memory problems, anger, depression, aggressive behavior. That's one of the top symptoms that we'll see. Anywhere between 11 to 90%, 95% of all traumatic brain injuries, aggressive behavior is one of the highest responses. So make sure you're asking your patient, were you angry? Have you been aggressive? Have you not been yourself? Have you been short with your children, your husband? Have you been short at work? Maybe people are treating you a little differently. Asking the patient if they remember all the details related to their normal processing, or do they have to read paragraphs over and over again? So concussion, another huge factor. Now, extensive soft tissue injury, make sure we're breaking that down, looking at lacerations, contusions, abrasions, anything that we can include in that record, and then of course any contusion, soft tissue that needs to be diagnosed separately, right? Those need to include separate codes, making sure you're looking at your ICD-10s or ICD-9s, whatever format you're using right now, that you're documenting that. Make sure you're separating the disc injuries, how to break those down. As I mentioned last time, I'm going to be breaking down 21 irrefutable laws of personal injury next week. We're going to start breaking those down, as well as giving you some new strategies and what you can use in your practice. But disc injuries, right? How do we analyze that? How do we break down the causal relationship with the patient's history, making sure we're separating those factors? If the patient doesn't have a pre-existing injury and never documented any lesion to the disc, then we're going to use that information here. Fracture, even looking at Small's nodes, right? Now that's indicative potentially of a fractured vertebrae, and making sure we're able to separate it from pre-existing to now obviously new, something that is new, and having some clinical wherewithal on how to break that down. Looking at lacerations, penetration wounds, right? May not see those too often, but if we do see them, we want to make sure we recognize them in the records as a symptom and or complaint, and then make sure we diagnose that. Obviously, ligament and tendon damage. We may not just see it just as we do the exam, but making sure that we're separating that and including that code again, as well as that recognition and doing the proper orthopedic evaluation and perhaps even radiological protocol, which is going to be really valuable. If we look at the superficial injuries, we typically may not see them as serious, but those have those value driver capabilities, making sure we do our job as proper clinicians. Subluxation, how do we define that? How we're including that, and then sprain strains of other body parts, right? Making sure that if we diagnose an ankle injury and it's sprain strain, segmental dysfunction, subluxation in that region, that we also have the orthopedic test to support why we did that. So muscle spasms being another big factor that we need to include, because its location and that it's the only objective sign value of soft tissue injury, right? So make sure that you're showing the palpatory, the texture, hypertonicity, evaluating that and demonstrating that in your record and how you've identified that. I had testified in a case about a little over a year ago. They asked the doctor how he came up with the assessment of spasm. Unfortunately, he didn't have an objective analysis. He just created the diagnosis of spasm. He didn't include that it was palpatory related, that he was able to visualize it, and that he was able to palpate it, right? So the doctor looked like he was not telling the truth, and that's where the defense firm had positioned him. So there's little things that can make a big difference, but make sure you recognize the region and even diagnose it associated with that region. So let's say you came up with a diagnosis of muscle spasm 725.85 and show that it's lumbar spine. You know, even write it next to that code. Why? You can, you have the freedom to do so, but at least shows that you found it in what particular area. Taking images, really strong strategy. Unfortunately, if we are working with law firms, they invariably lose a lot of documents. Well, I'm going to recommend take pictures of every one of your patients, any injuries, even if they're wearing a collar or a brace, documenting that, including that in that records. That's demonstrable injury, as we discussed in one of the other profit activators. So in many cases, the injury can only be seen, and many times the adjuster doesn't quite understand these things, and if the paralegal is represented in this case, they're discussing these points. These are going to be huge factors that you want to provide and make sense of this process. So I want to really make sure to take the advantage that you can explain things that everybody could read it, from the attorney, the paralegal, the adjusters, the defense firms, right? Make it clear and concise. Unfortunately, there's one of the major complaints that I've gotten from personal injury seminars is that my attorneys that attend these events, we have them fill out a questionnaire, and one of the top 3 is poor documentation. Many times I find doctors tell me the attorneys don't even ask for the documentation, which doesn't seem to make sense to me. How could this not be a great tool if we're including all the right factors? And my guess is that many of them have, in going to the seminars, but also in asking them, they say, you know, it's just not worth it. The records are just that bad. I'm better off doing it on my own. Well, if we're doing the right workups, this is going to be a great tool. And so I wanted to share these profit activators. I really hope that you were able to get at least one tip, one thing that you can go into practice today and make some changes in documenting and making sure you list them. Next week, we're going to be breaking down the 21 irrefutable laws of personal injury. These are going to be really concise, and they're going to include a lot of statistical research perspectives that we're going to make sure that we're in the best position to manage our cases and assist our patients in ways that they can't even imagine. And that's one of the things that gets them really excited, is that doing good personal injury work is being proactive. But managing this case, and it can make a huge difference in how we deliver the forms, questionnaires, the intakes, of course the symptoms, complaints, diagnoses, prognoses, breaking each and every one of those down, and then the diagnoses, the permanent impairments. All of these things tie into a perfect picture that can make life a lot better for the injured patient, and all they have to do is focus on their care. And that's going to be obviously the most important factor in keeping them compliant, because if they're not compliant, it's going to be obviously a big issue. So we look forward to bringing some more strong content for you. If you have any questions, feel free to reach out to me directly at Dr. Matt at personalinjuryinstitute.com, or feel free to call me at 972-978-2525. That is a direct line to me, and I'd be happy to answer any questions for you. Even if you're not a client of ours, I do speak with doctors and give them some guidance, and that's not something that I have a problem doing. I have the ability to do it. I own multiple offices, and my goal is to share these techniques that have allowed us to be very successful, and hopefully these tips have assisted you. So we look forward to bringing those laws to you starting next week, and as well as a very special breakdown approach and maybe some new systems that can assist your practice. And look forward to seeing you in our next video. Thanks.